On the road, in the gym, at a coffee house. No matter where you listen, this is Prevention Perk. I'm Steve Miller with Mid-America PTTC. It's time to perk up our prevention efforts. My guest today is Dr. David Anderson, Professor Emeritus at George Mason University. His research emphasizes college students, school and community leaders, youth, program planners, and policymakers. He's authored several publications addressing health and substance misuse prevention, including the 8 professional competencies for higher education substance misuse prevention, a topic we're going to explore during this conversation. Hello, Dr. David Anderson, and welcome to Prevention Perk.
Hello, Steve Miller. So good to be here. Thanks for having me.
Thanks for being the guest. Let's get started by having you explain to the audience how you got started in prevention. What was that path like that got you interested in this line of work?
Well, frankly, it was not planned. It was not planned. And in fact, I had something happen just in the last week. I was at a national meeting on alcohol and drug issues, recovery issues for higher education. And I was at the Ohio State University. And I was literally a couple hundred yards from where 50 years ago I started my professional career.
It's interesting.
50 years ago, I was a residence hall director starting in June of 1973. And during my experience, and so this is, to answer your question, how did I start my career? And the aha moment was just this last week. I was dealing with a residence hall, 700 students, undergraduates, and I had been a graduate assistant nearby in a residence hall with about 450 men. But in those 6 years of working in those residential environments, virtually all the problems that I faced as a hall director were drug or alcohol related. And, as a young professional, I was thinking, how do I go upstream with this? How do I work with the students so that they're not involved with drugs and alcohol and do not feel that need to have that? Sure, alcohol can be appropriate for those of the legal drinking age. But how do you keep that responsible? I was dealing with the heavy drinking. I was dealing with a new behavior that I had not heard of before, Steve, called drinking. Meaning, sure, I had experienced alcohol as part of an activity, but I had not experienced, until I arrived on that campus, I had not experienced drinking as the activity. That's different. Go bowling, have a beer. Go bowling, not have a beer. But I felt that real push. And then the other sad thing that was, again, a memory of mine is that was the first student death that I experienced in my residence hall, where a young lady had a drug overdose. And so how I got started, I wanted to do something upstream, wanted to do something prevention based. Now also remember the context. This is the early and mid 1970s. When did our national effort start? With our National Institute of Alcohol Abuse and Alcoholism and the National Institute on Drug Abuse was the early 70s, right? Like 1971, 1972. And so did we have public information? Did we have media campaigns? No. But I felt the need to do something upstream, dealing with that young lady's death. So I started my first residence hall program on alcohol issues in 1975. It was called All About Getting a Good Healthy Buzz and Other Ways of Getting High. Because I wanted to get at how can you get high without smoking a joint or having middle or moderate or large quantities of alcohol? How do you have fun? Let's go hiking. Let's read. Let's reflect. Let's exercise. How can you have fun? Let's just have conversation. So that's how I got started. When I left that job, I moved to Radford University in Virginia, and a colleague there, he was director of the counseling center, and I was second in charge of all the residence halls, 3,500 students. And we had both of us were interested in alcohol and drug issues. Both of us were interested in natural highs and helping promote that. We started something called the CARE Coalition while we were in our roles. helping students care about one another. But we were interested in what are other colleges doing across the country to deal with alcohol first, and then a few years later we thought about other drugs in that realm. So we started something called the College Alcohol Survey. We put together a survey of questions: what sort of policies, programs, services, support services, staffing, events, prevention events, and education. What are colleges doing? We looked at public, private, large and small, urban, rural, across the country with our sampling design. We got a great response. Remember, everything, this is 1979, everything was in the mail and print. And so we did that, and we got a great response rate. And then 3 years later, we said, I wonder how things have changed. We replicated the survey, the same sample. We updated some questions, and we got a better response rate. 3 years later, and then that got us national attention. We were on the front page of the New York Times. We were on the Phil Donahue show. So one thing led to another. 3 years later, we said, oh, we have a trend now every 3 years. And that survey, unfunded research, with the same sample, and repeated, and will be repeated again this February 2024. And my co-author, since Angelo Gadaletto has retired about 10 years ago, my co-author I'm bringing in the Higher Education Center, which is also based at Ohio State, while this conference was there. So one thing led to another. I started to do my dissertation. I was at Virginia Tech and did my degree work in public policy and public affairs. I kept getting drawn to alcohol, drug misuse and prevention. And I did my dissertation on drunk driving and how do you deal, and what's effective to deal with first offenders. I got into all sorts of different projects. I ended up at George Mason University as a faculty member, doing my teaching, taught the drugs and alcohol course, doing my scholarship, my community service. And while I was at Mason, I had 170 successful grants, many on alcohol and drugs, many on other health promoting type issues. Did a study a dozen years ago on understanding like high school, teen drinking cultures in America. And all of these various studies that are public and so forth, and other resources that we did. I did a lot of work with the NCAA on alcohol misuse prevention and evaluation and strategic planning. Although those remain on my website at www.caph.gmu.edu. And then had a couple of books, had one maybe 4 years ago, published by Routledge. And that was on leadership and drug and alcohol abuse prevention. And that's founded on my interviewing people who had been involved with drugs and alcohol for a long time in prevention, in treatment, in enforcement, as a researcher, as a policymaker. But I asked them all the same questions, like, how'd you get started, just like you did, Steve? And then some lessons and messages to community folks and state and national leaders on how to better address drug and alcohol misuse issues, from the primary prevention all the way through treatment and recovery and support of that. So that I did that book, and then that morphed into another book that I did with Tom Hall called Leading Campus Drug and Alcohol Abuse Prevention, and that's available through NASPA, NASPA.org. And that was directed right to college campuses. And each of those books has short essays, lessons from the field, case studies, innovation, people writing about, this targeted piece. Like the prior book with Routledge, has a several hundred word essay introducing DSM-5. Another one about distance learning, one about family issues. What's appropriate for treatment? Help me understand recovery. So lots of special essays. And so each of these books is designed to be applied. And so again, to the topic of today, I know you're going to ask me a question tell me about the professional competencies, but all of that and that journey over, if you will, 50 years, and more specifically, 48 years dealing with drug and alcohol misuse prevention. That started with that one residence hall program, 200 yards from where I was at this conference this last week, which was which was quite a moment to just experience.
Had to go full circle. That's really
I had to
very.
go, and then I had the opportunity to have a walk through that same residence hall. Yes, it's empty, but to walk through those corridors, see the rooms where discussions occurred, see the room where the young lady died. I mean, it was so important and so revitalizing.
You're listening to Prevention Perk. The funder of this project, along with all the other products of the Mid-America PTTC, is the Substance Abuse and Mental Health Services Administration. Although funded by SAMHSA, the content of this recording does not necessarily reflect the views of SAMHSA. During this episode, we're discussing the 8 professional competencies for higher education substance misuse prevention. To download a copy of this guide, visit www.preventioncompetencies.org. A few years ago, you launched into a partnership with Dave Clausen, who was my predecessor here at Mid-America PTTC, on developing a project that kind of differentiates, that the core competencies on a campus and how that compares to what happens in a general community. So, can we back up a little bit and maybe talk how this project got started with Dave and where you guys kind of got this impetus for this?
Sure. I had known Dave a little bit from some other initiatives, and then I get this phone call a couple of years ago, and he says, you know a lot about college and prevention issues, and I, Dave, know that colleges are different than a lot of other parts of society, communities and states and so forth. And he knew that I'd done the college alcohol survey every 3 years, so we've been tracking that for 45 years. And one of those findings in that was that do you have a coordinator managing your campus drug alcohol prevention efforts? And if so, how do they spend their time? And you'll see counseling and education and task force and research all within one person. And so he said, I think it's important that we highlight and get out there, what are some of these competencies that are needed? And I said, Dave, what do you want this thing to look like? And he says, I don't know. But you, if anyone, would know, what are the skills and attributes that are important to be effective? And so I worked on that, and we touched base as I was developing this. I looked at about 20 resources, something called the CAS standards, and various other publications about what is important in terms of the skills for a prevention professional on the campus. So what are the skills? And I came up with a framework. I had like 12 different categories, and I shared all this with him, and I ended up with, yes, I'm quoting the number correctly, 864 specific competencies. Sure, there was overlap. There was a competency that might go in 2 or 3 different categories. And then I organized them. What's most important for the brand new professional? Okay. And so that was a document submitted, and that was like 9 months of work. And then he says, how do we get this out there? So I said, the project is over. How do we get this out there? What might that look like? And I said, I have some ideas, but I need the advice and engagement of some others. I need funding for an advisory board. And so I selected 5 individuals, had some modest funding for them. These are people from the East to the West with different kinds. Again, they have different kinds of skill sets. And so I got the 5 of them involved, sent them the draft document with 864 competencies, and they said, no, that's too much. Nobody's going to read this. And I said, I get that, but this is our foundation. Now what can we do? And then we reorganized it. We focused on, what is the outcome we want from a resource like this? We want to make it usable and practical. So we have in our center, we have a visual graphic in our publication called Health Enhancing Environment. And then we narrowed it down and focused on 8 specific competency areas. Within each one, we have sub-competencies or specific topics from 7 to 10 in each of those 8 areas. And we organized each of those, if you will, 7 to 10 sub-competencies with the key focus on application. How do you apply? So there's a competency, again, 7 to 10 for each of those 8. Application. And then feeding into the application are 2 different things, knowledge and skills. And so there might be a couple of knowledge items that feed into the one application that is all a subset of the larger competency. And with that, we have 266 unique competencies, either knowledge or skill or application. It's organized and within that framework of 8. And so those are nice words. Those are my nice, if you will, aspirational competencies that we believe a campus preventionist, a campus prevention professional should aspire to, ideally. So we didn't separate out brand new versus you have 20 or 30 years experience. We said, focus on these, work on these for yourself, set some goals for yourself, and then those that you're gathering around you, as whether they're a part-time employee, a volunteer, a collaborator, they can then see these 8 competency areas. And we can talk about those if you want, but and they're all available on your website. And I have a shorter version of the website that points right to you and only to your website, preventioncompetencies.org.
Yeah, we'll put a link in the show notes. I think, and we could just kind of discuss the 8 competencies, but
Right.
maybe this is a simple answer to this question, and maybe it's complex. I don't know, but
Okay.
is it even important to try to differentiate between an intervention on a college campus and some kind of initiative in the community? I mean, if we're doing something in our hometown, why does it need to be different if it's on a smaller scale in a college campus? Why is that important?
Yeah, it's important because the campus is different. I mean, the campus is part of a community. Some campuses are isolated from the surrounding community. Some campuses, when they're closed in the summer, the whole community dries up. It just empties out. But the factors for prevention on the college campus, these are young adults. Typically, our ultimate audience is our students, and so the highest risk groups we have are the young adults, and then some subgroups within that. Particularly the first-year students, fraternities and sororities, and student athletes for various reasons. So there's different messages. So the message of prevention is different. The uniqueness of the collegiate campus is different, and the differences, if you will, with just drugs and alcohol is different than other, if you will, high risk issues, whether that's stress or mental health. They all intersect, but there's a lot of specific skills that we need just for that. Now, so the more flippant answer to your question is, when I did the leadership book through Routledge Publishers, I thought the criticism would be, there's so many college people contributing, and there's a large emphasis on the collegiate environment. I wrote it for community leaders that included colleges, because a lot of the skills in leadership, a lot of understanding of prevention or recovery or intervention or strategies or just being a leader, a lot of those are the same. So one would think, well, that applies, should be covered. You don't need a book for colleges. Well, colleges feel that they need college in the title. I mean, I know that's silly, but often college leaders feel, what's the application of something written generally for society or for communities or state and national leaders? What's the relevance to us? They need something directed right to them, so that you're talking about the dean's office, the vice president of student life, the fraternities and sororities. They want something, and I think it's helpful. And again, these 2 books complement one another. They have a lot of the content. Again, what is prevention? What is intervention? What is recovery? What are family issues? That is in the Routledge book. How do you think about orchestrating a comprehensive campus program is in the campus book, done again with NASPA, NASPA.org. So the college campus is different. And then a lot with our college campuses, we have veterans returning, we have people in recovery, we have lots of recovery support services, which is one of the things that is growing over recent years, particularly the last decade. So there's a lot of uniqueness to the campus environment that we don't find in the community. A lot of the other challenge is with alcohol, at least, much of the campus population is of legal age. And if they're not of legal age, they're close to legal age. When we're dealing with community, we're dealing with, again, the whole range. We're dealing with, elementary kids, pre-elementary, high school, middle school, and we're dealing with elders. And then one of the things that I've found from a separate research project I'm doing right now, following up on students who have been exposed to an online prevention program, is it's surprising what they're learning and what they had not learned before. In other words, they do an online program and they learn what's in a drink. Well, you're in college, don't you know that? Even though you're not of age, don't you know that? And when you think about it, what are the messages and what is the education that they're getting at the K-12 level today? Through the teen drinking study, which is, again, on our George Mason websites, www.caph.gmu.edu. If you look at the teen drinking study, we did a qualitative telephone interview with parents and kids. And one of the things we found is that the messages, this is what we were asking high school kids, what are the messages that they get from school or from their parents or from their teachers or guidance staff? What are the messages about alcohol? Real simply, don't. Well, how educative is that? The message is don't. It's wrong. It's illegal. It's bad. That's the message they're getting. So no surprise that when they do an online program in college and they're learning about alcohol or drink equivalency or consequences or some of the laws, some of the statistics that are not being taught in high school or in the community. So it's not surprising. So again, that helps to reinforce the college is a different environment. If they're 18-year-olds, vast majority of them will turn 21. Some won't. Some won't make it because of an alcohol overdose. And that's not even dealing with the drugs. I mean, then we have the whole current drug issues. So we can have different kinds of conversations. Most college students, vast majority, are of the legal age of majority, not legal drinking age, but legal age of majority. So we can have these conversations. And that's why colleges, that's in part why colleges are different, the environment as well as where the students are.
Let's spend a little time and we don't need to be real deep into the 8 components of it, but I think that it might be important that in addition to talking about the 8 professional competencies, how do these 8, in addition to maybe fleshing them out a little bit, how's that prepare the campus or administration for really, maybe they don't have anything now. How do they use these to start to develop something, or how do they use it to improve what they already have?
Yeah. So some campuses have nothing. And in fact, in my own national survey, I'm seeing, do you have a designated coordinator? That's gone down in the last few years. In other words, we don't have some, that's down. I think we're down to 81%, down from 95. I mean, that's sad and that's scary. I see a lot of erosion of campus efforts in the last half dozen years. That's not a COVID thing. That predates COVID. So regardless of where a campus is, here's how we think about this. Go back 30 or 40 years and look at campus security. Did we have armed police officers on campus? Did we have security or police who were trained? They go through academy. Sure, some schools did, but now that's pretty much the norm. When I was in charge of all the residence halls at Radford, again, 3,500 students, what was our campus health services like 40 years ago? I was a part-time nurse in probably was a basement storeroom. That was our health services. That's the professionalization of health services that has gone on. That's the contrast for the professionalization that's gone on. We've had that in multiple areas. We have some excellent campus prevention folks. across the nation. We have lots of dedicated folks. Often they are not valued by hires up. Often they are seen as, well, we'll have the coordinator fix it, deal with it. Everything gets dumped there, which is not a good philosophy. Again, think about multiple hats, from counseling to task force to research. So to look at a comprehensive campus program, to prioritize this as an issue, to know that there are lots of different skill sets. That's what we're talking about with these 8 competency areas. All of these are important to help support that so that we can help make more mature, more professional, and even more cost effective. So we can actually reduce costs over time because we don't have the negative consequences because we're dealing better with prevention. That's what prevention's for, is to reduce the negative consequences. The intersectionality between drug alcohol misuse and mental health. Okay, if we're dealing with those, we can deal with these in tandem. We can work on a whole range of wellness issues and reduce our drug and alcohol misuse, which therefore reduces property damage, reduces the loss of potential. We can enhance human potential. We can increase our retention rate and our student success rate by dealing with prevention. So I think what we're trying to do, to your question, is promote these to further professionalize these individuals and this office, if you will, office complex on a campus, to better address the range of issues on the campus. And I think what we're trying to do is help promote greater respect for the need for prevention and for the need for a well-rounded, broadly defined set of services on those individuals' shoulders.
Yeah. So this has been going on now with Dave Clausen, and then you and I've worked together
Right.
last 2 years, maybe close to 3.
Yeah. Yes, about 2.5 years.
It's culminated in a document, which is available. We'll have a link in the show notes where you can download a copy of the professional competencies for the campus. But you're taking it to another level with the help of the DEA, and you're going to get an opportunity to have more of an audio experience or visual experience in a project that they're doing on their website. So can you talk a little bit about the campus drug prevention project that you're doing with the DEA?
Sure. Just the context about the guide, and we'll talk more about some of those 8. Just the context on the guide is, it's not just the 8 competencies and fleshing them out. So I think the first 20 pages are, how do you use this guide? So someone who wants to use this, it's not just about the preventionist and their boss. We identify 7 different groups about how, and spell it out, a paragraph on each of this. How might you use this guide? And then separately for each of the competency areas, we have a link to resources. Here's some resources that help you on first competency, second competency, third competency. Here's half a dozen, 20 resources, whatever it is. And then separately, we have national and state resources. We have the federal agencies involved with this, the organizations. We have data sources. We have listservs. So there's a lot in that book. So the intent then, as I was shopping, the publication came out in October. So we're just dealing with 9 months since then, 8 months since then. I was shopping around. How do we help bring this to life? Sure, you can download the PDF file, you can do the links and get the resources and get the resources from the resources. But how do you bring it to life? And so I was shopping this around and connected with Rich Lucy, who's really spearheading the efforts at the Drug Enforcement Administration. And we just completed last week taping 8 webinars. That'll be on their website at campusdrugprevention.gov, campusdrugprevention.gov, and they have a practitioner's toolkit within that. You just have to find that. You'll have that in the show notes. But they're going to start to release 1 a week starting the second week of July, leading up 8 weeks later to the end of August, the start of the school year. So what I'm doing in each of those webinars, we'll start with the first topic called prevention science, and I interview one of the advisory board members, and the message is, how do you bring to life prevention science? Tell us a little bit about it. People can read the 3 or 4 pages in the Prevention Competencies Guide. They can read that. But bring it to life. Give us some examples. And then we have the second one with another advisory board member on drugs and alcohol. Bring to life. Bring to life. What are some real life stories on that? What are some challenges here? What is some advice you might want to give with respect to this, and how it links to the other 7 competency areas? In some of the topics, some of the competency topics, I have 2 of the advisory board members. So each of these is about 45 minutes, and a campus leader, a campus prevention person can use it to learn more about it. Again, bring to life that particular competency area. They might use it in a discussion with their advisory group. They might use it or use a segment of one. They might like a 2-minute segment out of one of the topics on, maybe it's on needs assessment and evaluation, or it's on some of the environmental strategies. They might have a 2 or 3 minute segment that they use in a training program, or use in a board meeting to help convince a campus administrator, this is important, here's why, and here's what that expert said on that podcast. So we're really excited that this is rolling out. The DEA has embraced this and is helping with the post-production. And again, they will have that released. We're sending the public relations information and the access to this to all sorts of national and state associations. We hope that our higher education preparation programs with their master's degree offerings start to emphasize drug and alcohol misuse prevention even more. And again, these are tools that help to promote, again, the competencies and the whole flavor of competencies, ongoing learning, continuing to learn, because new science is going to come out. Our module on prevention science has examples, and as the whole science of prevention evolves, we'll do more and do better and be more efficient. If this guide were to be rethought in 5 years, it might be 6 core competencies, because that's where we are in the year 2028 or 2030. Or it might be 10 because we missed X or Y, or something on our campus environment has changed. So this can be fluid. The intent is to have a continual learning process, which is the same thing we suggest for a campus with our local initiative, and for the professional. That's why I still go to conferences, is to continue to learn. Even though I've been doing this 48 years, I'm going to continue to learn. And so this is meant to be organic. It's meant to be inspirational. It's meant to be grounding. It's meant to be motivational. It's meant to be advocacy for further promoting prevention on our college campuses.
Well, we'll make sure and have a link both for the document and webinars. And as you talk about it, I think what a great partnership, because prior to coming to the PTDC, I didn't even know that the DEA had a campus drug prevention website, and the audience may not be aware of that. So this is a great partnership, because they're already doing some interventions on campuses nationwide, and this is just a new tool for their toolbox. So we'll make sure we have to that as well. And I wanted to point out, because you mentioned that one of the things about your document, when you and I first went through it, was it is very comprehensive on the resources that people can access. So, of course, in the age of technology, it's just a click away. Now, some of those things will change, but even if you're thinking, well, I don't really do a lot of work on a campus, I think you'll find that the resources in this guide are very rich and could be helpful in any initiative that you have.
Absolutely. And whether it's the data resources or the listservs, if you're committed to prevention, you're committed to making a difference, get on those listservs to learn what's happening.
You're listening to Prevention Perk. To gain a deeper understanding of the subject we're discussing with Dr. David Anderson, listen to the 8-part series about the professional competencies for higher education substance misuse prevention. A link to this series is available at www.preventioncompetencies.org. Well, I'm excited to see the webinars. I've read through the document itself, but I want to see the webinars and learn more about it. And we'll get everybody pointed in that direction through various links and so forth. The podcast will launch and people will learn more about it from there as well. But before we get away, I want to see if there's one last parting thought that you have, something maybe we didn't talk about related to the core competencies, or something else, given that you've been doing this for 5 decades. Is there some sage wisdom that you would like to impart to the audience?
Yes, I'll sum it up in a phrase, and I've used this for a dozen years. Where there's the will, there are the ways. Where there's the will, there are the ways. Our whole understanding of prevention, again, from tracking this with the College Alcohol Survey from 1979 to now, 45 years come this February, we've learned a lot. I mean, we see that the nature of our efforts has grown, and the acknowledgement that we need to have these efforts and even more efforts and more sensitive efforts has grown. But we've also seen stagnation over the years, meaning, like with that, we have a question like, to what extent do you pay attention to to what extent with your alcohol drug issues do you pay attention to the unique needs of these various subpopulations, whether they are first-year students or fraternity, sorority, or student athletes, or women, or people of color, or LGBTQ, or veterans, or first-generation students. So to a largest extent, several of those populations, the latter ones that I mentioned, are at the low end. But we knew that 20 years ago, and we haven't moved. Yeah. So we're not paying attention to people of color and unique needs with respect to drugs and alcohol any more than we were 20 years ago. Same with LGBT. So we know a lot of these issues, but we're not addressing it. So we're on a college campus, and for a lot of your listening audience, they're not on the campus. They're going to have sons or daughters or going there, or they may be contributors. Certainly many are alumni. They may be community advocates, but they can try to impact the campus. Many will be on the university and college boards. But we have a lot of the knowledge. We've grown a lot of the science. NIAAA with their College AIM initiative has referenced articles, referenced studies about proven practices. So where there's the will, there are the ways. So the biggest gap is with the support and the leadership on top of the college campus. The heart is there for the preventionist. The soul is there. So my message to them is to persevere. My message to the leadership is to listen to the prevention folks, ask how you can be helpful, and get out of the way, but provide the leadership, provide the inspiration, and say, this is important. We must do better. If we're dealing with the college students as an audience, they will soon graduate. Most will graduate. They will then become community leaders. They'll be in the business setting. They'll be supervisors. Many will have families. So to better equip them to help their audiences, wherever they are living and working and at home, be healthier and safer. So I think you highlighted the resources in the document. The document helps anchor themselves. I think that I've had others who are not in the college setting look at it and say, a lot of the content applies to other issues too. I mean, certainly drugs and alcohol applies to drugs and alcohol is one of the key areas, but strategic planning can be used for other issues. Needs assessment, evaluation, and research can be used for other issues. Environmental and policy issues can be dealing with other issues. Leadership is embedded as one of our core competencies. Program planning is, but also communication and advocacy. So looking at this, how it might apply to your listening audience's lives, anchor yourself, persevere, and again, where there's the will, there are the ways.
Well, I always enjoy the robust conversations that we've had, and this one did not disappoint. I always appreciate hearing from you, and I want to thank you so much for being a guest on the Prevention Perk.
And it's been my pleasure to be here. It's really, it's not on my shoulders now. I mean, I can advocate, but it's on the shoulders of your listeners now to carry it forward.
Thank you so much. And we want to thank you for listening to Prevention Perk, a podcast from Mid-America PTTC. To learn more about our innovations, visit pttcnetwork.org and look under your PTTC for the Mid-America link. Remember, prevention is better together, and together we are stronger.